everyone. Today we're going to be presenting pediatric leukemia. It's going to be myself, Isabel, Alicia, Navdeep, Hardeep, and Natalia. So first, what is childhood leukemia? Leukemia is a typically non-inherited disease in which large numbers of immature, abnormal white blood cells are produced on the bone marrow. Abnormal white blood cells flood the bloodstream, affecting the production of oxygen-producing red blood cells and platelets. Normal white blood cells protect the body from infection and disease. A large production of abnormal white blood cells makes the body very susceptible to infections and diseases. Leukemia affects more than 3,500 children in the U.S. every year. On this side, we're just showing normal blood and then what it looks like in a patient that has leukemia. And then symptoms of leukemia, frequent infections and fevers, easy bruising or bleeding, bone or joint pain, unusual fatigue and breathlessness during activity, loss of appetite, unexplained weight loss, night sweats, swollen glands, usually lymph nodes, and anemia.
So this slide is showing the effects on the body of childhood leukemia, the risk factors that can cause leukemia, a genetic predisposition, Down syndrome, HIV, extensive exposure to artificial ionizing radiation. How is leukemia diagnosed in children? Bone marrow aspiration for biopsy, lymph node biopsy, lumbar puncture, x-rays such as uses a small amount of radiation to take pictures of bones and other body tissues, lab tests of blood and bone marrow samples, tests like flow, cytometry, and immunohistochemical DNA and chromosome set.
Common forms of childhood leukemia: acute lymphoblastic leukemia, very rapid production of abnormal white blood cells known as the lymphocytes that are released into the bloodstream before they mature. This is the most common form of leukemia and strikes children 3 years of age and younger and young teenagers. So they have 75% of all pediatric cases. Second one is the acute myelogenous leukemia, also known as AML, a very rapid production of abnormal white blood cells known as the myelocytes. This form of leukemia strikes children as well as adults. So 20% of all pediatric cases. Complications of leukemia in children. So there is two types, short-term complications and long-term complications. Short-term complications include serious infections, severe bleeding, thickened blood from large number of leukemia cells. Long-term complications, return of leukemia, growth of other cancers, heart and lung problems, slowed growth and development, osteoporosis. Then the treatment of leukemia. Intracathal chemotherapy, a cancer-killing drug that is administered into the cerebrospinal fluid around the brain and spinal cord to keep it from entering the child's central nervous system. Radiation therapy, high energy rays are aimed at the affected area to shrink tumors and keep cancer cells from growing. Bone marrow transplant, stem cells are taken from healthy bone marrow and are introduced into a sick child's body to create a new blood factor that will hopefully produce healthy, mature white blood cells. Maintenance chemotherapy, administered cycles over 2 to 3 years to avoid reoccurrence. Leukemia will almost always reoccur if the chemotherapy is not received. Various new drugs. Many ongoing clinical trials introduce new drugs, offer more effective treatment with minimum impact on the quality of life.
This is a picture of a child getting chemotherapy and bone marrow aspiration and biopsy done. Phases of leukemia treatment. Induction. During the induction phase, chemotherapy and medications are given. Sometimes radiation is included. The idea is to kill leukemia cells in the blood as well as their parent cells in the bone marrow. The goal of this phase is to enter remission. which would then mean the leukemia cells are no longer being made. The phase may last about a month, but can be repeated if the goal is not reached. Consolidation treatment is continued even though leukemia cells may not be visible. Though the leukemia cell may not be seen in the blood test or bone marrow examination, it is still possible that the cells are present in the body. The goal of this phase is to kill any remaining cancer cells. Phases of leukemia treatment continued. Maintenance. During the maintenance phase, less intense chemotherapy is given over a long time. This phase can last months to several years. The goal of this phase is to prevent relapse. Regular visits to your child's doctors are required to make sure the treatment is working and to check for any recurrent disease. Relapse, refractory, or recurrent leukemia. Relapse is when the bone marrow begins to make cancer cells again. This can occur at any phase of the treatment. It may also occur months to years after the treatment. The expected outcome and treatment options are relapse depends on several things. Begin the length of time being the length of the time between the diagnosis and when the leukemia returns.
Survival rates in childhood leukemia. ALL, acute lymphocytic leukemia, has a survival rate about 90% overall. In general, children in lower risk groups have a better outlook than those in higher risk groups. But it's important to know that even children in higher risk groups can often still be cured. AML, acute myelogenous leukemia, has a survival rate now of over 65% up to 70%. However, survival rates vary depending on the subtype of AML and other factors. For example, most studies suggest that the cure rate for acute prolomedic leukemia, a subtype of AML, is now higher than 80%, but rates are lower for some other types of AML. Juvenile myelomonocytic leukemia, JMML, has a survival rate of about 50%. Chronic myeloid leukemia, which is rare in children, and a 5-year survival rates are less hopeful because some children may live for a long time with the leukemia without actually being cured. In the past, 5-year survival rates for CML were reported to be in the range of 60 to 80%. But with the newer, more effective medicines used to treat CML in recent years, survival rates are likely to be higher now. What is the outlook for a child with leukemia? This will depend on the following: how far the disease has spread, the type of leukemia, how will your child respond to treatment, genetics, age, and overall health, how well your child tolerates the treatment. The outlook will be different for every cancer. Getting to a doctor and starting aggressive therapy quickly are key for the best outcome. A child with leukemia needs constant follow-up. Survivors can suffer from side effects of radiation and chemotherapy. How can I help my child with leukemia? You can help your child manage his or her treatment in many ways. The child may have trouble eating, and a dietitian may be able to help. Getting emotional support for your child by finding a counselor, encouraging the child to get some exercise for overall good health, and balancing rest and activity.